The wrong one. Hi.
Hi, nice to see you. You look so cute. I love
Thank
you
you,
too.
thank
Yeah.
you. Thank you, thank you. And we are live. This is the face and the voice of Dr. Tolu Olabinton, CEO and founder of Living Spring Family Medical Center here in the awesome city of Mansfield, Texas, where we believe in helping our patients live long and well. And today we're going to be having another Facebook Live with the awesome Dr. Raina Gupta. Hi, Doc. Thank you for coming. I know you're busy. I appreciate you for coming. How are you?
Hi, I'm doing well. Thanks so much for having me.
Awesome, awesome, awesome. So, for the sake of those who are watching, by the way, if you're watching live, hashtag live. If you're watching a replay, hashtag replay. Of course, invite your friends to watch. But please, Doc, can you kindly introduce yourself to those who are watching? Who are you and what do you do?
Sure. So my name is Raina Gupta. I'm a neurologist and sleep medicine specialist. I live in Chicago and working on helping patients to optimize their sleep as well as optimize their quality of life.
Awesome. I like what you do. Our reasons align. So we help improve quality of life. I love that. Now, why do you do what you do? What got you interested in sleep medicine?
Yes, great question. So one, I always felt the brain was very fascinating. And of course, sleep is one of the functions of the brain. More specifically, when I was in school. So when I was in medical school and I was pushing myself and working hard, as many of us do, I started to deprive myself of sleep and I started to try to push myself harder. And that's when I learned the power of sleep. I learned that I was really sleepy. I was falling asleep in class. My concentration was off, and I started trying to understand a little bit more physiology of sleep. And so I learned that sleep is very powerful, and we can try to use it to work for us or use it to work against us. And started trying to learn more about sleep. And so now that I understand this a little bit more, I try to help others to use the power of sleep to help them and optimize their quality of life.
Awesome. And you're so right. A lot of times, sleep is the one thing people want to give up on or say, hey, who needs to sleep? I actually had someone tell me, or there's a saying that says you sleep when you die. So, but who needs sleep? You just keep going and going. But sleep is
Right.
very, very important. So I'm glad that we're having this conversation. Now, our topic today is Doc, I snore. What's the big deal? And for some of you who are watching, you would agree with the notion that a lot of times people think snoring is a sign of, man, that's really good sleep, right? So I'm going to pose that question to you. Is snoring a bad thing? I thought it was just a sign that you're getting really good deep sleep. What would you say to that?
Yeah, so let's understand snoring a little bit better. So what makes snoring? Why do some people snore and some people don't? So snoring is happening in the upper airway. So we're talking about the throat and the nose. So across the board for everybody, when we sleep, our airway relaxes. When the airway relaxes, the air pushes to come in or out of the airway. As the air pushes in or out, it can cause vibration of the relaxed muscles along the way, and that's snoring. So we all snore in given conditions, especially when alcohol or substances are on board,
Mm.
and that relaxes the muscles. We can snore when we're very exhausted. We can snore when we're sleeping completely flat. Anybody could snore in some of those instances. But snoring can be a concern and it can be a warning sign for something bigger. And so snoring is not all okay or a sign of great sleep. It can also be lead us to better understand other sleep disorders or sleep issues that could be going on.
Okay, very, very good to note. How do you know? Because you did mention that not all snoring is bad, and snoring could be a sign of something else. So, what are warning signs? Would you say maybe the top four that snoring in a particular situation or a particular patient is not good?
Sure. Yeah. So if the snoring becomes very loud, so loud meaning you can hear it through the wall to the next room, we call loud snoring more than 50 decibels. So 50 decibels would be like conversational. So number one, loud snoring. I would say another one, disturbed sleep. So if there are awakenings because of the snoring, if there are abnormal breathing patterns, as somebody witnesses, like if you are the bed partner or the family member and you can hear somebody stop breathing, snore, stop snoring, snore, and there might be fluctuation in their breathing. So that could be another one, as witnessed by others. Third one could be if somebody is very sleepy during the day. So sleepy, tired, poor performance, poor concentration, even falling asleep at the wheel, even more serious things. And the last I would say is if someone sort of wakes up choking and gasping. Sometimes I have patients that feel like they dream about it. I dreamt about choking or gasping and I woke up, which could happen, but that could also be a sign of you're actually waking up and choking or gasping. So these are very common signs of obstructive sleep apnea. And these are sort of warning signs that might trigger, hey, I wonder if you have this, or I wonder if we should check this out. Because snoring is there, but snoring could be more serious.
Awesome, awesome. You mentioned four critical points as to when snoring can be an issue, and that led you actually to our next question: sleep apnea. We've had that word used often. I'm sure some of our viewers may be familiar with that. What is sleep apnea?
Yeah, this is a great question. And it's a little confusing because there are different kinds of sleep apnea.
Okay.
So, one of the types is obstructive sleep apnea. And so that's what we're talking about here as it relates to snoring. So, obstructive is descriptive. There's an obstruction in the upper airway. So, we talked about the upper airway as it relates to snoring. So, sleep apnea, obstructive sleep apnea, consists of two events. So, either the upper airway closes or collapses, causing the airflow to be blocked, or the upper airway becomes narrow, causing the airflow to be reduced. So either of these events has to occur, and they have to have a negative impact or negative consequence on the body to be counted as sleep apnea, whereas snoring does not have to have a negative impact. So the negative impacts of sleep apnea could be to disturb the sleep or to decrease the oxygen in the blood or both. So these events have to occur and they have to have an impact on the body, and that is obstructive sleep apnea.
Thank you very much for explaining that. And one of the things I found, and I tend to encourage patients to have this addressed, is because it's also linked to uncontrolled high blood pressure, arrhythmia, so abnormal heart rhythms. So it's not just I don't get good sleep. It can lead to other long-term consequences, and that's why it is important that it needs to be addressed. Now, I had someone ask a question, and he said, "Is there a cure for snoring?" What would you say to that, doc?
Yeah, there are lots of cures, potential cures for snoring. So a couple things that we can do. So now we understand what is snoring, what is obstructive sleep apnea. So of course you want to check out which one is present. But just pure snoring, which is primary snoring, there are a lot of things that can potentially help with it. So we already talked about alcohol or substances. So removing those or decreasing them, especially as it relates to bedtime, can help. Weight. So weight is one significant factor that can be a trigger or can be precipitating snoring or obstructive sleep apnea. So, weight in general, like our body mass index, as well as weight around the neck, so the neck circumference. It's not something we think about much as weight, but of course, it's muscle and soft tissue, it's general weight, as well as genetics, how you carry the weight. So, both of these are risk factors for obstructive sleep apnea as well as for snoring. So, weight loss can help. A lot of people snore more on their back as opposed to on their side or stomach. And some of this is because as we sleep on our back, the airway can relax and so can the tongue and push back into the airway. Um, if we try to sleep on our side and the snoring improves or decreases, that could be a win because maybe that is effective to treat snoring and or in some cases to treat obstructive sleep apnea. So these are things to think about. There are other things that we can use for snoring. They're like nasal breathe right strips. I'm sure a lot of us have heard of them and maybe tried them. If this obstruction is in the nose, if the obstruction is in the throat, there are mouth guards that people can wear. So I think there are a lot of hacks. The question is, what is this and what works best for you?
All right. So this essentially you're saying, it's important to get an individualized evaluation to see what the cause is, if it's reversible versus irreversible, if it's something that can be taken away or not, and that can be addressed one-on-one. So for someone who's watching here and who's saying, I know someone who sleeps next to me who snores heavily. Now, and of course, these discussions are not done to make us afraid or make us scared. It's to make informed decision, meaning, oh, is there something that's potentially wrong? Is there something that's explaining why maybe someone who I sleep next to feels the way they do during the day. But what would you say to them? Say, how can I, real quick, check to see if there's something wrong with the snoring before I come to see you? Let's say, Dr. Gupta.
Yeah, there's a couple different things that can be done. And at home, we all have smartphones now. There are apps where you can record people snoring. You can record your own snoring and get what's called a snore score. So this gives us at least a little bit of feedback outside of, the person that's observing us when we sleep, to tell us that yes, you snore, no, you don't snore. Here's the severity or the loudness. Not everybody has a bed partner or a family member around. A lot of people live alone. And so how would you really know, except for, hey, I feel tired. Why do I feel tired? So that's one sort of easy way of getting an understanding. Yes, there's snoring. No, there's not snoring. Also getting a judge of how you feel during the day. Are you feeling like optimized? Even if you sleep enough, what is enough for you? Or sleep well? How do you feel during the day? Of course, it's always best to speak to your doctor and decide if you need to get further evaluation, if you need to see a sleep medicine specialist, if you need to get sleep testing done, if you need to get any treatments.
Awesome. Awesome. Thank you. This is good. This is good. So I hope for those who are watching, we've learned a thing or two about what sleep apnea is, how we can kind of try to self-diagnose, and when it's time to go see a doctor. So I'm going to ask you that question. For those who are watching, all right, doc, I know I snore. Everybody tells me I snore. When should I come see you? Three points. When should I come see you?
Sure. So a lot of the things that we mentioned, right? If there's poor concentration, poor wakefulness, if we're drowsy, if we're feeling tired, low energy during the day, or if there's some concern about our sleep for other reasons. Of course, a lot of patients will come from their other doctors, from their cardiologists, from their anesthesiologist before their surgery or during their surgery or during their hospital stay if their oxygen was low. But those are, we don't want to wait that long, or from their primary care with their blood work being abnormal. We don't want to wait that long to get a sleep evaluation because, as you mentioned already, we know that obstructive sleep apnea and sleep disorders can lead to other health problems. And of course, our goal is to avoid all of those, improve that control of our sleep, as well as how we feel during the day.
We want to make the most of the time we sleep.
Yes.
And that's key. You spend 7 hours, you wake up, you feel like you didn't have any. So we want to improve the quality of sleep so we can make the most of our day. Thank you so much, Dr. Gupta. This has been very insightful. I took notes. I hope you guys did as well. For those who are watching who are like, this doc, I like her. Where can I connect with her? So, Doc, where can people find you?
Yeah, sure. So I have a big project coming soon. I'm working on starting a private sleep medicine clinic in Chicago. So look out for it. It's called Sleepology Health and Wellness. Website is under construction. So please check us out if you know anybody that's interested or lives in the local area. Let them know that we're here and we'd love to work with them in the coming months.
Awesome. Awesome. Thank you so much for coming. I appreciate this. Was golden. Thank you. Thank you. And for those of you who are watching, who watch with us all the way through, thank you so much for watching. We appreciate this. Please share. And if you or anyone you know is looking for an awesome, a thorough, a passionate family physician who helps patients live long and well, I am she. Have a good one and happy Tuesday.
Thank you.